Hi gang. So thought I'd welcome you to my bedroom. Hi. Um it's where I spend most of my time. So as you can see, I've changed my hair colour again. What I want to do is just kind of show you my placement bag really, sort of thing. Like what do I take? If I'm missing anything, is there things that I should be putting in? Obviously depends on placement really. So yeah, so here's my fancy rucksack that I take every single placement. I believe a rucksack is a lot better. You're able to fit a lot more in. So like when I take my jacket, I can just throw my jacket in there. Because some placements kind of don't seem to have hangers, so you can't. Oh, obviously it's small little staff room, so there's not enough places to put your stuff. So just kind of like wrap everything in my bag. So yeah. So here we go. So in here, I have my fancy, you know, my student nursing. I think that a badge to say your name and obviously who you are, sort of thing, is absolutely fantastic because not a lot of placements let you wear your landlord with your student obviously ID. A lot of people don't have bank jobs in the hospitals, or if you do, you're not really allowed to wear them anyway. So just think obviously name badge, obviously what your profession is. Your patient is easily able to remember your name for one, even though you go, hi, my name is, or hello, my name is Leah, I'm a student nurse. Majority of the time people forget, staff members forget, your mentor forgets, so don't be upset if they do, because they have that many students. Also consultants as well. I believe it's important that they know who you are, what your role is. The only placement I've not been able to wear my student badge is when I'm in theatres, because obviously you got scrubs on, so you kind of not allowed to wear anything. But yeah, I was able to wear a different head thing, so they know who I was anyway. So yeah, so always have a badge. Oh, that's upside down. Always have a badge. I bought mine off eBay. I think I spent like $1.99 or something on it. So yeah, if your university doesn't have a name badge, go and buy one. I was going to buy the hello my name is, but I just kind of went for the cheap one. It doesn't really matter. People just read it and then it is what it is. So I'm a student quality ambassador as well, so I have my fancy lanyard for that. So I have like a little, oh god, can't wait this out. A little fob for when I do my observations in a particular ward. So hand gel, everybody needs hand gel. Obviously infection control, not a lot of like, especially if you're out in the community primary sector sort of thing, hand gel is amazing because you don't always have the opportunity to wash your hands outside when you're on the go constantly. Obviously in the wards, hospitals, slightly different sort of thing because there's alcohol gel on the end of every single bed, and obviously you got hand washing facilities. So yeah, hand gel, always a good thing. So this is my fancy little thing. I absolutely love it. I have a little pocket organizer. So yeah, so I bought this off, I think it was eBay again. Love eBay. I think I paid $3.99, something like that for it. Absolutely handy. Obviously it's got half of what I usually put in there, because a lot of it's fell out. So let me get all my crap out. Take everything out. Ugh. Right, okay, so I usually have, not all three, but I do usually take one or two board pens. So these obviously, for obviously the patients, I'm just going to put behind like it's the patient's bed. They'll usually have a whiteboard on them or different coloured boards, whatever. So I can ensure that their name is on for one, because a lot of people, when they transfer a patient, don't put the patient's name on, and that's important. The fact that we know who you are, and obviously the patient needs to know that they are welcomed into a place. Who the consultant is, not a lot of places have it, but some people do. So it's important to know who the consultant is, because obviously if you're ringing up any department sort of thing, go, oh, such as their consultant. And also I use it, and I shouldn't, but I do, on my little, we call it like a mad cow, it's like a moving computer. I like write little lists on there, and then I'll just wipe it off after I've done it, sort of thing. So I'm like obs for bed 1, 3 and 5, and then I'll just cross it off just to make sure that I've done it. Because I don't believe that you should write a patient's name on there, because obviously if somebody comes on, it's kind of like confidentiality, so I kind of just go with the bed number. But I do know who my patients are. I believe that patients should be called by their name and not a bed number, but obviously for the purpose of my observations, I'll go, bed 1 is I need to do their observations, bed 2 sort of thing, rather than going, Dave, Bob, need their observations sort of thing. I just like to keep it so I remember which bed, because a lot of the times you go onto a ward, bed numbers will be dead easy, and then other ones it's like exactly like which one's bed 5, because it just, some places are just fucking confusing. So yeah, so board pens, always good, dead cheap to buy sort of thing, Home and Bargains, B&M, as to Sainsbury's, wherever. So yeah, so also in my little organiser I have 2 pairs of scissors. My throat's going. Let me get them out. Ooh. Right, so my first one, I love these. I bought these from funkinurse.com, I think it was. I think they were $3.99, something like that. Obviously used for dressings, absolutely fantastic, especially when I was out on the community, and even when I've been on a ward placement, or like when I was in the nursing home. It was obviously cut through. It's hard doing it on my left hand. Cut through sort of thing, nice and easy. Ooh, can't get these ones up. So these ones, and I threw them on the floor. Bear with me, going down. Back again. So these ones I absolutely love. I was given these actually in my work. So I work in a brain rehabilitation unit as well, on the side. So I got these given to me, which were fantastic. So that saved me some money. So these I absolutely love. Cannot fault them because I use them all the time. So yeah, they're my 2 scissors. But you can pick them up pretty cheap anywhere anyway. The fantastic pen for the eyes. So absolutely handy for when you're doing a GCS, so Glasgow scale, on a patient if they've come into A&E or if they're on your ward, and obviously the deteriorating sort of thing. Obviously if you're going to do your A-to-E assessment, obviously in a day, I'm going to blind myself now, you're like, I know that's not how you do it, so don't worry. So yeah, obviously you're just assessing, if I can show you now, assessing their eyes to see how big they are, obviously, and whatnot. And then some pens. I have other pens, but obviously I always go for this style of pen because it's easier, and a highlighter.